exam review, be sure that you have your two devices, your chargers for those devices. Ensure that you have worked through the practice exam. Make sure that you have your ID. In the event that you will use Stretch, you can use a dry erase board. Instead of paper, you need to have a dry erase board, or you can use one of those sheet protectors, those clear sheet protectors. By 2034, the number of Americans aged 65 and older is expected to exceed the number of children that are 18. So it's looking by 2034, which is not very far off, the number of those Americans that are at least age 65 will be more than those that are actually 18. The largest cohort in the aging population are the baby boomers, and these were born between 1946 and 1964, those baby boomers. How does society feel about aging? Are our cultural perspectives generally positive or negative? No matter what the age, no matter what the disease process, no matter what the payer source, we want to provide that best care for our patients. We don't want to assume ageism because of a certain age that um, our clients are, you know, automatically have cognitive problems or automatically have problems with finances. Okay. What are some of the sources of financial well-being for older Americans? Most will have retirement, some are even still working. So we have advance directives. These are legal documents that should be honored. These documents will either place someone in charge of making the decisions, and that person can be in charge of making decisions about the person's health care, their finances, and the other one leaves the person actually leaves the wishes actually written out what they want. For example, if they don't want to be resuscitated, and they don't want CPR in the event that they need CPR, all of those wishes are made out and written out. And these are legal documents, and we honor those. We do want to remember we are mandated reporters, so be thinking about the signs that we would see if someone is being abused. We don't have to confirm and do the investigation, but in the event that we suspect that there are some things going on, just think about those signs that you will see. Bruising that can't be explained. The person may be acting that they're fearful. For example, if you're doing an interview and there's someone that's accompanying that person, and the person you're interviewing the patient, which is an elder, the other person doesn't even give that person a time to even explain or give answers. Using their finances, doing other things, paying other things with that person's money, other than the person send you to the grocery store to pick up items, and the person actually used that money to pay some of their bills. So all of these things, being left alone, not being taken to their doctor's appointments, all of these things are signs of abuse. Okay. Abusive behavior in family members, signs of financial abuse. We talked about that. Support for family caregivers. They do have respite care. So in the event that we do have a caregiver and that family member might need some rest or to go on, they may have some type of important meeting or trip or something. So respite care can be provided for their loved one while they go and take care of whatever it is that they're needing to do. Okay, so this one speaks to elder abuse again. It said unauthorized use of physical and chemical restraints. Administered, a person may even have a medication prescribed, but it's the orders might say as needed for pain. But we do know most of the time a lot of times pain medications actually slow things down, and so it makes that person sleepy. So if we administer that medication for a reason other than the reason that is listed as needed for pain. If we give it for to make that person go to sleep, then that is considered an unauthorized use. Using restraints, having all four side rails up, that's considered a restraint. That person cannot freely let those rails down. They're not using those rails for turning and repositioning. Those are considered restraints. We are mandated reporters. We do not have to confirm and know all the details. But if we, in the event that, there's suspicion of abuse, we do need to report that. Okay. Reporting abuse, true or false? A mandated reporter is a person who is required by law to report a suspicion of abuse. Nurses do not need to report elder abuse if it is strictly emotional. Concrete evidence of abuse is needed before a report can be filed. A nurse working in a hospital or clinic does not need to report abuse if it took place in the patient's home. Okay, so the only one that is true is we are mandated reporters. All those others are false. Okay. Biologic theories, how aging affects our cells, the gene theory, immunology theory, wear and tear theory, psychosocial theories, how our attitudes and actions affect the quality of aging. That's activity theory and Erickson's theory of lifespan and development. Okay. Let's look at this. I'll give you a moment to look at these and jot down for your first example, second example, third, and fourth. Put your like 1, 2, 3, 4, and then put A, B, C, or D. So we'll give you a little time. Okay. All right. So a 77-year-old patient is trying to decide if he made a contribution in life. That is Erickson theory. It's a development. Okay. An 88-year-old man with frequent respiratory infections contracts pneumonia and declines rapidly. That's that immune system, the immunologic theory. An older woman needs a knee replacement. That's that wear and tear due to that severe osteoarthritis. And then that free radical, a 90-year-old man takes large doses of antioxidants to avoid damage from harmful molecules. The role of population health. Population health refers to the health outcomes of a defined group of people, such as older adults or school-aged children. Public health nurses focus on disease prevention, health promotion, and health protection. Regular screenings. Remember, we're screening to determine or detect if there is a problem, if there's a disease, if there's an injury or something going on that that patient would need to follow up for. Social determinants of health include biological, socioeconomic, psychosocial, behavior, and social factors that affect well-being. Think about smoking, drug use, and then the opposite, no smoking. How does that affect a person's well-being versus someone that smokes? Alcohol use, person that doesn't use alcohol versus a person that does. How does that affect that person's well-being? Why is it difficult for many older adults to change their health practices? Health behaviors are learned early in life. Change can be difficult. Older adults adapt well to aging, but may have trouble adapting to new habits or adjusting to new living situations. Just think about that older person learning to use TikTok or even Facebook. Okay. And then lack of financial resources, chronic illnesses, lack of transportation, limited mobility, all those things can affect that person's health practices. It is important that we inform that patient of, give them all the needed information, because more than likely that plan is for their betterment. So adherence to following that treatment plan is going to be promoting health for that client. And so, but we do let the patients make an informed decision. So, and we will support their autonomy, but they do need to know the consequences of non-adherence in the event that they do not follow that treatment plan. Maintaining a healthy weight, lower calorie requirements with higher nutritional value, avoiding excessive weight loss or gain. Practice that portion control. Remember that my plate. The purpose of it is for portion control. It helps us to control those portions. Decreasing that sodium and sugar and fat intake. Managing that blood pressure because we found out, that blood pressure being out of control affects so many other things because that heart is having to work overtime extra just to get that blood to the brain all the way down to the baby pinky toe, keeping those blood glucose levels normal. All that extra sugar in that bloodstream is harmful to those kidneys, to your eyes. Okay, so how much exercise is recommended for elderly? So, and they need to just make sure that what they're doing is not it's safe for them to do. There are sitter sizes people can sit. They have many exercise plans out there. So a person that has limited mobility, a person that has limited sight, they're alternative exercise plans and exercises that they can actually do. Denture safety, watch for signs of choking. Those dentures can break and those pieces can come apart. Loose dentures should be adjusted. If a person's dentures are not fitting well, it more than likely is going to irritate and cause pain in that mouth, which can lead to a domino effect. That person um, could stop eating or taking less calories because it's painful for them to chew with those dentures. So we want to make sure that those dentures are well-fitting dentures. So this is a list of health screenings for men and women. Mammograms every other year, clinical breast exams every year, bone density exams, first screening at 65, pap test 3 to 5 years, colorectal screening. I think it's down to 45 years of age now. And they have various ways of doing that colorectal cancer screening, that prostate cancer screening, vision, hearing, and dental. This is a vaccination immunization recommendation chart. So influenza, Tdap, pneumonia, and then shingles. Flu every year. The pneumonia, that dose every year. And then shingles is just one dose per lifetime. And then the Tdap booster every 10 years. Okay, we've got a little case study here. Mrs. Jones is a 66-year-old, and you are the LPN reviewing her immunization record. Which vaccinations will you administer if it is January 2026? Okay. Okay, let's go back to our little chart here. So make note of that. Okay. Got it. Why are older adults at greater risk dehydration? Percent of water in the human body. So there's even less as a person gets older of percent of water that's in the human body. And so therefore that person will need to consume more. Okay. Which of the following conditions places an older patient at risk for abnormal fluid and electrolyte loss? Think about which ones is going to deplete the body. So diarrhea and vomiting. Yes, so if you have a patient that has diarrhea and vomiting, then you're gonna have to be careful with that. Be thinking about dehydration. What foods would you recommend for an underweight older adult who is at risk for malnutrition? Okay, which food should the nurse prioritize for an older patient who has a poor appetite? Okay. Of course, that was proteins. Look at the picture here. Got it. Which food groups provide the most energy? Carbohydrates. And what are some examples of those carbohydrates? What foods would you recommend for an older adult who has diagnosis of iron deficiency anemia? Liver, all iron, things that are full with iron. And then the labs that we use to monitor is iron, legumes, and beans. Okay. Which foods are high in the following essential vitamins? Okay, this chart comes from Williams, and here it is right here. So for vitamin A, we have milk, cheese, butter. D, that fortified milk, cod liver oil, eggs. Vitamin E, you have corn, those leafy green vegetables. Even for vitamin K, it's leafy green vegetables as well, and liver. We have liver for vitamin A, and we have liver also for vitamin K. Okay. Vitamin B1, that thiamine replacement, organ meats, whole grains, and then vitamin B2, that riboflavin, milk, cheese, and eggs is similar to vitamin A as well. Okay. So, what are those sensory changes? There might be loss of vision, loss of hearing, changes in taste and smell. There may be decrease in mobility. So, be thinking about things that could put that person at risk for falling or injury. So, if a person has a eye disorder, then their vision more than likely will be limited. So, what things do we need to ensure that's in that walkway? Things are in reach. Make sure that rugs are have that non-slip padding behind them, and well, throw rugs are just not recommended. But in the event that a person does have to have one, make sure they have that non-slip padding. Mary had two falls in the past 6 months. She attends a water aerobics class to maintain her strength. She takes pain medication for her osteoarthritis, has a diagnosis of overactive bladder, and sometimes takes a sleeping pill for sleep disturbances. Which of these facts about Mary indicate that she is at risk for fall? Okay, that she is at risk for fall. We do know pain medication tend to slow things, so it might alter her, it may make her sleepy and groggy. The osteoarthritis, she could be at risk for limited mobility because of it. The overactive bladder, maybe trying to rush to get to the restroom. And then sleeping pills, it does alter your cognition. It makes you sleepy and groggy as well. So all of those things puts her at risk for falling. Fire safety, smoking, we want to ensure that that person has smoking carbon monoxide detectors, you know, that they have a fire extinguisher. And in the event that something happens, do they know the route of exit? In the event that there's a fire in the home or the apartment or the assisted living facility, do they know what that route is of getting out of there? Do they have fire extinguishers readily available? Okay. Right. Dosage calculation. Make sure that you have the right conversions, the right unit, and the correct rounding. If it tells you to report the answer in the nearest tenth, make sure that you're rounding to that nearest tenth. Okay. Double check your conversion factors. Make sure that you're converting correctly. Okay. Make note of these. 1 teaspoon is 5 cc's, 1 tablespoon, 15 cc's, and so forth. Remember about the rounding. If the question asks you to report to the nearest hundredths place, make sure that you're rounding out to the nearest hundredth place. It's that second value after the decimal point. If it's the nearest tenth, it's that first value after the decimal point. So make sure you're answering what is asked. And we do have some examples here. Round the following numbers to the nearest tenth. So 10.54 would be 10.5. 161.43 would be 161.4. And then the 212.75 would be 212.8. Okay, the nearest whole number, 8.25 equals 8, 10.7 equals 11, 164.9 be 165. Got it. Okay, now here's a example you can practice. Okay. Okay.